International Nurses Day is celebrated every year worldwide on 12th May to commemorate the birth anniversary of Florence Nightingale, who is revered as the founder of modern nursing. International Council of Nurses commemorates this important day each year with a theme, and the Nurses Day theme for the year 2021 was Nurses, a voice to lead, a vision for future healthcare. The Vision for Future Healthcare seeks transformation of healthcare and supporting nurses to leverage a better health system. The COVID-19 pandemic not only changed the world as we lived, but also raised the visibility of nurses like never before and underlined that nurses are indispensable to healthcare and the backbone of every health service. Nursing as a profession is vital to contribute to building healthier communities. The National Florence Nightingale Award carries with it a certificate, a citation, and also cash reward of Rs 50,000. Srimati Chandra Mallik has 35 years of experience in remote villages of Andaman. During tsunami, she has saved many lives and has contributed much in COVID management in remote areas. Her main areas of services include immunization and antenatal care. Srimati S. Vijaya Saigal has worked in different health facilities of Andaman and Nicobar in the community and hospital and given 38 years of dedicated services. She has worked as a COVID-19 warrior. Her contribution with vast experiences in OT is highly appreciated. She has undergone additional training in first aid, human relation in healthcare, HIV/AIDS, essential newborn care, etc. She has participated in various conferences. She has received letters, certificate of appreciation from NGOs, Police of A&N as Corona Warrior. Srimati Miryala Jhansi Rani has 25 years of experience. She has given dedicated services to AP government health sector. She has worked as frontline COVID warrior and is awarded a certificate of appreciation. She has attended additional training and continuing nursing educations in stress management, HIV/AIDS, blood banking, the Global Fund to fight AIDS, tuberculosis and malaria, basic life support, advanced cardiac life support, midwifery services and medical transcription. Srimati M. Jhansi Rani has received many appreciation letters from local and state authorities. Srimati Longku Yak has 26 years of experience in public health, particularly in serving tribal population. She actively participates in implementing all national health programs. She is actively involved in COVID vaccination program. She has worked as team leader of Pradhan Mantri Suraksha Mantri Arogya. She has attended many counting nursing education programs at district and state level. She has received letters of appreciation from the local health authorities. Miss Shabrun Khatun, working as A&M Primary Health Center, Sadar Darbhanga, Bihar. She has contributed actively during COVID-19 and received certificate for her dedicated work. Miss Nazia Praveen is dedicated nurse with 11 years of experience. She has contributed in setting up labor room and has received certificate of excellence in preparing standard operating procedure. She is a skilled birth attendant trainer and has participated in Pronto International Simulation training. She has attended many training programs on clinical management of COVID-19, pregnancy and COVID, nurse monitoring program, simulation facilitator training, neonatal care, neonatal resuscitation program and cardiopulmonary resuscitation. Ms. Nazia Praveen has been recognized as district as well as block level topper by State Health Society Bihar for scoring highest in competency based rating. She has been given Certificate of Excellence and several appreciation letters from local bodies and TNAI. Ms. Harinder Kaur has 30 years of work experience in nursing service, out of which 19 years of service in Government Health Department, Chandigarh. She is a mentor in labour room for Lakshya Quality Control. She served as a role model for respectful midwifery care and provided exemplary services in the area of maternity. She has managed labour room for COVID-positive mothers, has contributed in setting up COVID-19 isolation rooms. She has also participated in COVID vaccination drive. She has attended many continuing nursing education programs. Mrs. Harinder Kaur has received many certificates of appreciation from local authorities. Srimati Lissi Achankunju is presently working as Assistant Commandant in ITBP with 30 years of work experience. She has worked in Srinagar for 3 years during the time when military was at peak. She has saved the life of a newborn in an emergency situation in Srinagar. She has also saved the life of a person with snake bite. She has worked beyond duty hours during outbreak of hepatitis in Srinagar and dengue in Delhi. She has developed administrative skills as matron of a referral hospital in Noida. She has been awarded 4 commendation roles, 3 insignias from DG ITBP. Srimati Varshaben D. Rajput has provided dedicated services to Gujarat government health sector for over 2 decades. She actively participated in COVID-19 pandemic-related activities, being a noble officer in nursing. She has performed safe delivery of a pregnant woman in auto rickshaw. She has contributed in development of specialty units in her hospital, including intensive care unit and central sterile supply department. She has received letters of appreciation for her outstanding work from her institution. Shri Defta Chaturbhai Khima Bhai has provided dedicated services in the Community Health Center for Gujarat health sector for more than 2 decades. He has done diploma in Operation Theatre. He has conducted many safe deliveries during his posting in primary health care. He has saved many lives of victims of snake bite and insect bite by giving cardiopulmonary resuscitation and doing endotracheal intubation. He has also worked during COVID-19 pandemic as frontline worker. He has organized many eye camps and looked after bedridden patients in the community. Srimati Savita Rani has given dedicated services for over 12 years of experience as staff nurse. She has contributed significantly to the care of COVID patients and other related duties. She has been a regular motivator for blood donation and has participated in various blood donation camps. She has been given several appreciation certificates for blood donation camps by Red Cross Society and many other NGOs. She has been appreciated by an NGO for her COVID-related activities. Srimati Pramila Devi has given dedicated services as staff nurse to Government of Himachal Pradesh for over 3 decades. She has trained skilled birth attendants on adolescent health and HIV/AIDS. She attended various training programs in reproductive and child health, nursing administration, the Global Fund to Fight AIDS, tuberculosis and malaria, skilled birth attendant, and ICT reproductive and child health. She was appreciated for her contribution to Kaya Kalp activities. Shri Ahmed Ulha Wani PBBSc is working as nursing supervisor in charge of hospital infection control team and in charge of COVID-19 block in Srinagar. He has over 30 years of experience. As in charge of emergency department, he has significantly contributed during snowstorm, earthquake and flood in Kashmir. He has attended various training programs and organized many workshops and conferences in his institute. He has made many presentations in continuing nursing education workshops and conferences. He is an academic counselor for nursing administration certificate students. He is also member of various NGOs and Nurses Association. Srimati Sanjeeda Banu has more than 30 years of experience and is working as Junior Health Assistant in Primary Health Center, Lingadhali, Chikmagaluru, Karnataka. Srimati Lakshmi Maitre has 20 years of experience and is working at Primary Health Center, Ghatboral, Bidar, Karnataka. She has participated in various national health programs. Dr. Elsa Sanatombi Devi Professor with 21 years of experience is an excellent teacher, researcher and leader. She has undergone numerous nursing and health-related certificate courses. She is author of 3 textbooks and has many research papers published in national and international journals. She is a member of various professional organizations. She has conducted webinars and conducted clinical research studies on COVID-19 pandemic phenomena. She counseled COVID-19 quarantine inmates of Manipur via online and published reports of their experiences. She took active part in training nurses for COVID-19 pandemic work. Srimati P.S. Kaveri has retired from service on 30th March 2021 after 31 years of her service in Chikmagaluru district. She had rendered excellent services during her tenure. She received award of excellence at district level. Srimati Sheila Rani V.S. is working in the government sector as palliative care nurse in the Kidangur Gram Panchayat since January 2011. As a palliative care team member, she actively delivers home care, being supported well by the state government and local authorities. She is known for her excellent and committed services in palliative care. She has undergone training programs at local, district and state level on palliative care. She has received certificates for recognition from local and district authorities for her dedicated services in palliative care. Srimati Susan Chacko has 17 years of experience and has worked in operation theatre, palliative and pain clinic. She has specialized training in neuro-nursing. As an infection control nurse, she was involved in training more than 1,400 healthcare workers. She has served as a member of various hospital programs to improve the services. She has actively worked during COVID-19 pandemic. She is a district level assessor for Kayakalp and National Quality Assurance Standards. She has attended many training programs on infection control, National Quality Assurance Standards and is a trainer for National Health Mission. Mrs. Suman Chacko has been given appreciation certificate for her outstanding and dedicated services. Mohammad Qasim AB has been rendering dedicated services in Lakshadweep Community Health Center for the past 15 years. He has significantly contributed to palliative care. He was in the team of health professionals for pilgrims going to Saudi Arabia. He has received Certificate of Excellence for outstanding services to the consulate in serving the Hajj pilgrims. He has saved the life of 20-year-old man on board ship at sea in critical condition with severe crushed injury and profuse bleeding. Mr. Mohammad Qasim AB has received many certificates of appreciation and Best Nurse Award for his outstanding services by local health authorities and NGO. Shrimati Manisha Bhausojadho has 16 years of experience and has successfully implemented all the national health programs and was actively involved in the delivery of maternal and child health family planning programs. She was appreciated for being the frontline tuberculosis care provider. She has attended continuing nursing education at state and district level to update her knowledge and skills. She has received certificate and appreciation for her excellent work from local and district health authorities. Shrimati Raj Shri Tulsi Ram Patil has 22 years of experience of appreciable service in public health. She is actively involved in implementation of various national health programs. She has attended various counting nursing education programs and remains updated with recent trends in public health. She has received many awards at district, state level for her contributions in the field of public health. Shrimati Anjali Anant Patwardhan, with 39 years of experience, has worked as Senior Enterostomal Therapist Officer in charge and then as Professor Director of India's first Stoma Therapy Clinic. She is the first Indian nurse to be trained as enterostomal therapist at USA and established India's first Stoma Therapy Clinic and Enterostomal Therapy School for Nurses. She is dynamic in managing ostomates and has counseled hundreds of ostomates. She is a recipient of many awards for her services to ostomates at local, national and international level. She has made several scientific paper presentations nationally and internationally. Shrimati Alka Vilas Korikar has given dedicated service for over 3 decades in the area of public health and is currently working as state public health nurse. She has actively participated in all national health programs. She has participated in flood relief work in Raigad district in 1989 and rehabilitation work for Latur post earthquake. She has attended additional training in reproductive and child health training of tutors, legal aid, counseling for women, maternal child health and vaccination storage. She has received A grade in effective vaccine management assessment by UNICEF in 2018. She was given appreciation certificate by State Health Officer for her exemplary work. Shrimati Thaime Sanahambi has contributed more than 35 years of dedicated service as A&M in various institutions in Imphal East District. Her dedicated and people-friendly services has been recognized and appreciated throughout her service by villagers and local authorities. Her extraordinary contributions in flood relief and COVID pandemic activities are commendable. She has also attended training programs and workshops as part of professional development. She has received certificate of appreciation for her outstanding contributions. Shrimati Takhilambam Helena Devi has 16 years of experience and is currently working as Community Health Officer. She has actively participated in different national health programs, creating public awareness on COVID-19. She has prepared masks and distributed to the public. She has also trained ASHA workers. She has attended various training programs, example HIV/AIDS, tuberculosis and malaria/AIDS training, skilled birth attendant, mental health, family planning model and infection control. Ms. T. Helena Devi has received several certificates of appreciation for her dedicated services. Shrimati Vairokpam Hemabati Devi has served the community of Thobal district, Manipur for more than 3 decades with great dedication, commitment, enthusiasm, compassion and professionalism. She has implemented various national health programs at unreachable areas of Manipur. Her dedication in geriatric and palliative care and reforestation is remarkable. Her performance to fight COVID-19 as the real COVID warrior is highly appreciable. She has received many certificates of appreciation in recognition of her services. Srimati Victorialness Similiash, BSc with more than 3 decades of experience, is working as Assistant Director Nursing in Directorate of Health Services, Shillong. She has worked sincerely in improving nursing services and setting up various nursing units. She has established pulse polio booth, antenatal clinic and functioning of OT at different centers. She was responsible for management of COVID-19 pandemic by setting up designated COVID-19 wards and Corona Care Center in the district. She has conducted continuing nursing educations for nurses on HIV/AIDS, polio, Kayakal program and disaster management. She is recipient of many awards and letters of appreciation for her meritorious services. Srimati Vanlal Roy has given dedicated services for 28 years with commitment. Her main areas of service include maternity and emergency services. She has helped a mother with severe antepartum hemorrhage. She has helped a victim of road accident by providing him first aid and has saved the life of patient who attempted suicide by giving gastric lavage. She gives training on intrauterine contraceptive device, postpartum intrauterine contraceptive device insertion and on tuberculosis care, child abuse for nurses, ANMs and ASHA workers. She has been appreciated for her outstanding work by the local authority. Srimati Geeta Rani ANM from National Capital Territory, Delhi, joined service in 1994 and has 26 years of experience. She is an exemplary service provider and has contributed towards achievement of national health goals. Her services to the community during COVID pandemic is well appreciated and certified by the authorities. Her enthusiasm to update her knowledge and skills in healthcare services has promoted her professional growth. Her teamwork was also well documented. Shri Jonels Alvin McEwan, MSc, is working as Senior Nursing Superintendent in a Divisional Railway Hospital with 13 years of experience. He is an excellent innovative clinical nurse who did exceptional work during the COVID-19 pandemic. He has trained nurses on infection prevention practices and developed SOPs for isolation wards. He developed an innovative robocart for COVID-19 isolation wards and implementation of Railway's Swasthya E-Mitra health education program. He has received appreciation awards from railway authorities for the outstanding performances. Brigadier Punita A. Sharma, MSc, is presently working as Brigadier Southwestern Command with more than 36 years of experience in military nursing service. She is a nursing administrator par excellence in the field of nursing practice, education and research. She is instrumental in upgrading School of Nursing to College of Nursing. She has undertaken many projects such as counseling, running a location clinic and several outreach activities. She has published 2 books and many research articles in various journals. She has updated herself by attending many short-term and diploma courses. She is a recipient of various awards, certificate and appreciation for her distinguished services in military nursing services. Srimati Meera Mukund Dhote is working as Deputy Nursing Superintendent with more than 30 years of nursing service. She has done diploma in nursing administration. Her contribution to Apex Trauma Center of AIIMS, New Delhi is commendable. She has contributed greatly in revamping the trauma center into first COVID center during the pandemic in March 2020. She was instrumental in streamlining the functioning of COVID care center at AIIMS as leader and manager. She has presented many scientific papers and participated in various state and national level workshops. Ms. Meera Mukund Dhote has been given several appreciation certificates for infection surveillance in hospital for Kaya Kalp and Swachh Bharat Abhiyan. Srimati Damayanti Roth, an ANM, has been serving the people of villages in Odisha and has 25 years of experience. She has actively contributed in implementing national health programs. She provides excellent and committed services to the population of Gongi Ghasa Subcenter. Her contributions in achieving 97% immunization coverage with no maternal and infant death and during disasters reaching any part of the population using bicycle are commendable. Ms. Sibani Das has 21 years of experience. She has good leadership skills. She has managed as nursing superintendent during COVID-19. Her contribution is appreciated by local authorities. She has undergone many short-term courses, continuing nursing educations on COVID management, tuberculosis, HIV/AIDS, etc. to update her knowledge and skills. Srimati Khulana Parekh has given dedicated services to Government of Odisha health sector for more than 2 decades. She has worked in different departments of the hospital, mainly in A&N postnatal checkup. She is a trainer of intrauterine contraceptives device, postpartum intrauterine contraceptive devices, insertion, and gives counseling to pregnant and postpartum women. She has also participated in tuberculosis and HIV programs. She has worked during cyclonic storms FANI 2019. Her dynamic performance is appreciated by local authorities. Srimati V. Angalaishwari has contributed more than 23 years of dedicated service to the community, covering public health programs with special reference to maternal and child health services, communicable and non-communicable diseases, and health education campaigns. She has actively participated in COVID-related activities. She was keen on updating her knowledge and skills by attending various training programs at district, state, national levels. She had received the Best A&M Award in 2007 by the Government of Pondicherry. Srimati V. Saraswati is presently working as Public Health Nursing Officer in Pondicherry. She has 11 years of experience in government hospital, 10 years on deputation as lecturer, and 13 years as public health nurse. She is a very dynamic professional. She has prepared videos for diabetic patients and participated in various community education camps and conducted many counseling sessions for schools. She has attended many state-level training of trainers for ASHA, A&M, LHV. She has appreciation certificate from the local authorities. Ms. Surinder Kaur has given dedicated services in the field of community health for over 3 decades. She has contributed significantly to save the lives of 6 road traffic accident victims, working continuously in Operation Theatre for 15 hours without break. She has conducted various health education camps in her district. She has taken additional training in cancer detection and Ayurveda ministry training. Ms. Surinder Kaur has received several appreciation letters from local authorities. She has also received appreciation certificate as a Corona warrior. Srimati Indu Lakshmi Sankla is working as A&M in Primary Health Center in Jodhpur and has 24 years of experience. She has contributed in different national health program implementation and received various appreciation letters for her exemplary work. Shri Ram Prasad Meena is working as a senior nurse in nephrology department in SMS Hospital, Jaipur as chief coordinator of transplant program. He has provided dedicated services since 3 decades. He is actively involved in counseling for organ donation of brain dead patients' relatives. He has participated in several community activities, example blood donation camps and vaccination camps. He has attended several short courses in transplant, cadaver care, intensive care unit, emergency care and attended various conferences and workshops as well. Mr. Ram Prasad Meena has been awarded State Florence Nightingale Award by Government of Rajasthan and is also recipient of Merit Award for Best Work in Organ Transplant Program by Honorable Health Minister of Rajasthan. Srimati Tika Devi Pandey has more than 30 years of experience as A&M in tribal areas. She is very active, enthusiastic and service-minded. Her major areas of services include integrated child development services, immunization, health education, mental health, school health and COVID-related activities. Has worked as frontline worker during COVID pandemic. Srimati Tashi Lamu Sherpa is currently working as an assistant nursing superintendent. She has given dedicated services for over 2 decades. She has undergone additional training in oncology, essential newborn care, cervical cancer, and integrated skill reproductive and child health. Besides her hospital duties, she is also doing welfare work for nurses with one NGO. Srimati E. Mangammal has more than 30 years of experience as A&M. Her services in the area of maternal child health care are commendable. She has updated her knowledge and skills by attending many training programs. She has received many rewards and recognition for implementing national health programs. Srimati S. Selvi, she has more than 30 years of experience. She actively participated in implementing the various national health programs. She has saved the life of a pregnant mother. She has received appreciation and recognition at district level for her services, especially in the area of maternal health. Srimati Atashi Mujumdar has 32 years of work experience in various areas of the hospital. She has actively participated in various health camps and national health programs. She has attended several continuing nursing education programs, ophthalmic care, operation theatre technique, emergency nursing, etc. Ms. Atashi Majumdar was given appreciation certificate for her activities in Kaya Kalp. She has been awarded Best Nurse Award by her hospital. Srimati Suman Dubey has provided dedicated services to the hospital nursing service over 2 decades and has done excellent job during COVID-19 pandemic. She has organized various training programs and poster exhibition on COVID-19. She has supervised polio vaccination drive and Java Javi Suraksha work. She was given 3 certificates for appreciation of her work in pandemic, including newspaper coverage as Corona Warrior. She was also appreciated for her work in Ayushman Bharat program. Srimati Ganga Joshi has more than 17 years of services as A&M. She is known for her dedicated service to the community. She has undergone many training programs in public health at state and national level for professional development and service delivery. She is a recipient of many certificates of appreciation. Srimati Shashikala Pandey is working as nursing sister and has more than 20 years of experience. She is a quality assessor at district level. She has actively participated in Kaya Kalp activities. She has worked in COVID-related activities with full enthusiasm and is given Corona Warrior certificate. Ms. Shashikala Pandey has provided exemplary services to a blind disabled person for 26 days, for which she has been given appreciation certificate. She has also received many certificates of appreciation from local authorities for her dedicated services. Srimati Smithakar has 16 years of experience in a tribal area at West Bengal. She has implemented many national health programs and shown improved statistics of health indicators. Her major service areas include maternal child health, control of communicable, non-communicable diseases, and tuberculosis. Her life-saving initiatives for a pregnant woman is especially documented. Her services has been greatly appreciated by the district health authorities. Srimati Sona Das has 12 years of dedicated services, of which 7 years is exclusively for tribal population. She has contributed maximum to the health and welfare of the tribal population, serving them with dedication and commitment. She was involved in saving the life of a mother and baby during childbirth and was appreciated by local health authorities. She has actively implemented national health programs. She had attended many district level training programs.